Avoidant restrictive food intake disorder, ARFID. ARFID stands for Avoidant Restrictive Food Intake Disorder. Someone with ARFID might avoid eating certain foods or types of food. They might restrict how much they eat to the point that it has an impact on their physical and mental health. Anyone can have ARFID. Although someone with ARFID might lose weight or have low weight, this is not always the case. It can happen to anyone at any weight. It's also different for everyone. ARFID is more than being a picky eater. It's restricting your food intake to an extent that it has a negative impact on your health. It may cause you to become underweight, cause nutritional deficiencies, cause you to rely on nutritional supplements or tube feeding. Have a significant impact on your day-to-day life. Impact your mental health. It's not driven by worries around body shape or weight. Symptoms of ARFID. There are lots of things that contribute to the avoidance or restriction of food intake. There's a wide range of possible signs and symptoms of ARFID. If you have ARFID, you might not have all of these signs. Possible signs and symptoms of ARFID include sensitivity to some types of food depending on the texture, smell, or temperature. Only eating a very limited range of food. Always having the same meals. Always eating something different to everyone else. Only eating food of a similar color. Trying to avoid social situations where food is present. Finding it difficult to recognize when you're hungry. Feeling full after only a few mouthfuls and struggling to eat more. Taking a long time to eat meals. Finding eating a chore. Being anxious at mealtimes. Chewing food carefully, taking small bites and sips. Nutritional deficiencies like anemia caused by not having enough iron in the diet. You might also need to take supplements to make sure your nutritional and energy needs are met. ARFID can have a negative impact on your physical and mental health at any age. For example, a young person might not gain weight as expected and it could affect their growth. Someone with ARFID might find anxiety about eating has an impact on their day-to-day life. What causes ARFID? Someone with ARFID might have one or more reasons for their avoidance or restriction of food at any time. Sometimes there's no clear reason. These are some of the most common reasons. sensory-based avoidance or restriction of intake. If you have sensory-based avoidance, you're likely to be sensitive to the taste, texture, smell or appearance of certain food types. You may also only be able to eat foods at a certain temperature. Concerns about the consequences of eating. Someone who's had a distressing experience with food might be worried about the consequences of eating. For example, concerns about vomiting or choking could cause fear and anxiety around food. Low interest in eating. Someone with a low interest in eating might be unable to recognize feelings of hunger. They might have a generally poor appetite. They might also have a low interest in eating or see eating as a chore and not something that's enjoyed. Related conditions. Someone might have ARFID as a condition on its own. Sometimes there are other conditions that occur alongside ARFID. The most common are anxiety disorders, autism, ADHD, physical health problems like gastrointestinal conditions. Speak to your GP if you're concerned about your health. Diagnosing ARFID. When making a diagnosis, your GP will ask questions about your eating habits. It's important to answer these questions honestly. Your GP isn't trying to judge you or catch you out. They just need to accurately assess your symptoms. Your GP may also check your weight and other physical measurements. What to do if you're worried if you, or someone you know has ARFID. Make an appointment with your GP if you think you might have ARFID. If you're worried a friend or family member has ARFID, it's important to talk to them. Try to support them and encourage them to speak to their GP or another health professional. Have more information on planning an appointment, how to talk to your GP and what will happen at an appointment. Treatment for ARFID. There are different treatments available for ARFID depending on your symptoms. Your GP can refer you to the right service for treatment depending on your situation, symptoms, and age. Young people. Young people might access treatment through a health visitor for children under 5. Child and Adolescent Mental Health Services, CAMHS. Community pediatric services, including speech and language therapy, occupational therapy, and dietetics. Their local community eating disorders service for children and young people. Adults. Adults with ARFID might receive treatment through specialist eating disorder services, general mental health services, or another healthcare professional. Treatment often includes family-based therapy, cognitive behavioral therapy, behavioral interventions like exposure work, anxiety management training. Treatment might also include nutritional management with support from a dietitian. You might also receive help for sensory problems. Complications of ARFID. ARFID can lead to severe complications and health problems. These can sometimes be permanent. People with ARFID have an increased risk of poor circulation and cardiovascular problems, heart conditions, like coronary heart disease and irregular heartbeat, arrhythmia. Health problems caused by malnutrition, a lack of vitamins and minerals. ARFID can cause an imbalance of minerals in the blood, like potassium, calcium and sodium. These minerals help keep you healthy. When there's an imbalance, it can cause symptoms like tiredness, weakness, dehydration, seizures, fits, irregular heartbeat, arrhythmia, muscle spasms, confusion. Further support. Find information and services that can offer advice and support about eating disorders.